Hi everyone, and welcome back to another episode of our radiography review series. Today we're going to dive into a topic that can make or break your patient interactions, and even your success as a technologist: interpersonal communication. This is more than just being nice. It's about being intentional in the way you talk, listen, and respond to patients and team members, even in challenging situations. It is also an important part of the ARRT exam and something you'll use every single day in practice. So let's get started. Section 1. Why communication matters. Good communication builds trust, reduces anxiety, and ensures that your patient understands what's happening and why. It also helps you gather accurate information and work effectively with your team. Poor communication, on the other hand, can lead to confusion, mistakes, and even legal problems. So let's talk about the different modes of communication you will use. Section 2. Modes of communication. First, we have verbal and written communication. Verbal communication is exactly what it sounds like: speaking clearly and using language the patient can understand, avoiding jargon and technical terms. For example, say pictures or x-rays instead of radiographs. Or rather than say, suspend your breathing on your second inspiration, you may wish to say, take in a deep breath and hold it. Written communication includes things like giving written instructions for prep or aftercare. These should be easy to read and use plain language. Next, we have nonverbal communication. In many ways, this is just as important, if not more so, than what you say. Things like your eye contact, facial expressions, posture, tone of voice, and even how you use touch can convey reassurance and empathy, or impatience and frustration if you're not careful. A gentle touch on the shoulder, a calm tone, and a reassuring smile can go a long way. So remember, patients are paying attention, not just to what you say, but how you say it and how you act. Section 3. Challenges in communication. Of course, not every patient interaction is easy. There are a number of challenges that you will face. First, language barriers. If your patient doesn't speak English fluently, you will need to slow down, use simple words, and avoid slang. When possible, use a certified medical interpreter. Do not rely on family members or co-workers to translate. They may leave things out or add their own opinions. Secondly, cultural and social factors. Some patients come from cultures where modesty is very important, or where they're uncomfortable asking questions. Be respectful, explain clearly, and adjust your approach to meet their needs while still providing proper care. Third, physical, sensory, or cognitive impairments. A patient who is deaf may need you to write things down or face them directly so they can read your lips. Someone with dementia may not understand instructions and may need a caregiver present. Patients who are in pain or sedated may also have trouble following directions. 4. Age. Children need simpler explanations, often with a little reassurance that they won't feel pain. Elderly patients may have hearing loss, slower processing, or anxiety about the procedure. Be patient and give them time to respond. And fifth, emotional status and acceptance of their condition. Patients may be angry, upset, or in denial about their diagnosis. They may be going through the stages of grief, denial, anger, bargaining, depression, acceptance, and your job is to stay professional and supportive no matter what they are emotionally. Section 4. Explanation of medical terms and strategies for understanding. Patients can easily get lost when you throw medical terminology at them. Instead of saying, "we need a PA chest," you can say, "we're going to take a picture of your chest from the back to the front." Avoid abbreviations and technical language as much as you can. And to make sure your patient really understands you, try these strategies. Speak slowly and clearly. Use visual aids, demonstrations, or gestures when possible. Ask them to repeat the instructions back to you. This is called the teach back method, and it helps confirm that they understand. Be patient if they need something repeated. Remember, it is better to take a little extra time than to risk them being confused or non-compliant. Section 5. Patient education. A big part of communication is educating your patient about what's going to happen before, during, and after the exam. First, explaining the current procedure. Tell them what the exam is for, how long it will take, and what sensations or noises they might experience. As we use radiation, you may need to use examples as discussed in the ARRT method to relay some form of understanding that radiation is a part of our normal background experience. Next, pre- and post-exam instructions. Some procedures require preparation like fasting or drinking contrast. Make sure the patient knows exactly what to do and when. After the exam, tell them if there are any restrictions, like avoiding certain activities or watching out for some side effects. Finally, responding to questions about other modalities. Patients may ask about the differences between X-rays, CT, and MRI, or about the relative radiation doses. Keep your answers general and within your scope. You can explain the basics, but avoid giving medical advice. Section 6. Ergonomics and monitoring. Now, before we wrap up, let's talk briefly about ergonomics. How can you protect yourself while helping patients? Radiologic technologists have a high risk of back injuries, so good body mechanics is essential. Keep your back straight and bend at your knees, not your waist. Keep your center of gravity low and close to the patient. Do not twist. Turn your whole body when moving or lifting. Patient transfer techniques are another key skill. Assess how much the patient can help. If they can stand or pivot, guide them carefully. If they cannot help at all, use assistive devices and get help from co-workers. There are also safe patient handling devices that can make this job easier and safer. A transfer board helps slide a patient from bed to table. A Hoyer lift is a mechanical device that can move heavy or immobile patients. A gait belt provides stability when walking with a patient who is unsteady. Using these tools not only keeps your patient safe, it protects you from injury as well. Alright, that wraps up the review of interpersonal communication, patient education, and ergonomics. Remember, how you communicate and how you carry yourself physically can have just as big an impact on patient care as your technical skills. Practice patience, stay professional, and adapt your approach to meet each patient where they are. Thanks for listening, and as always, keep studying, keep practicing, and keep striving to be the kind of technologist patients can trust and feel comfortable with. See you next time.